Hi everybody, I'm Dr. Ejiro Dr. calling from Corrective Step Health Center in Tigard, Oregon. We are going to be taking out a soft tissue lesion, as you can see right here. Unfortunately, this has been around for a while and it's been problematic for our patients, causing it to bleed when it gets bumped into. At this point, it's too large to kind of do a punch biopsy or a freeze, so we are going to do a surgical excision. As you can see, we already have the area prepped. In terms of our betadine, you can see the needle sticks, so that means she is numb as well too. And we'll ask patient, can you feel this at all?
No.
Very wonderful. So we're going to start. Patient's in a comfortable position. I'm in a comfortable position. I'm going to give a little tension to the skin. We're going to start our 3-to-1 elliptical incision. So with a sharp number 15 blade, I've already made out my marks, my shear lines, but that's okay. That means it's going to be a very, very beautiful plastic surgical technique to bring all her skin back together. And if you can see closely, she does have a tattoo. I usually don't like to go through tattoos for incisions, but they promise that they're going to get a tattoo of their third or fourth favorite podiatrist, so hopefully I'm in the running. I do like to use epinephrine in my local anesthetic, so that does help to minimize bleeding and also helps to increase the numbing effect after the procedure is done. So now we're taking this lesion out in total. I'm checking underneath to see if there's any stalk, to see if it's something else, because skin lesions the skin can only present itself in so many different ways. So sometimes things that are very similar present themselves in similar pathology.
Goodbye.
Good riddance. Put in our orange specimen cup, and the doctors at the hospital will tell us what's growing out. Now I'm going to clean this up a little bit, flush it, dilute betadine solution. I don't see a stalk, which is really good. So a stalk would mean that there's a source or something feeding that lesion from deeper within. This is right over the ankle, so that means it could be coming from the ankle joint or some tendon sheath, and we see good healthy skin tendon sheath underneath it. So now we go into the closure mode. So her skin is pretty flexible, so I'll take a generous layer initially and do some horizontal interrupting so we can get some eversion. So my mom was a seamstress. She taught me how to sew. This may seem like I'm giving her credit or giving her the blame. That's just small talk. We were talking about Easter just a little bit before this video started shooting, And one of my highlights for Easter is we used to always make our own Easter outfits, get new Easter outfits. My mom was a seamstress, so she'd make them. So one of the ways she taught us how to sew was we'd make our own Easter outfits. We go to the store, Joanne Fabrics is no paid advertiser, but we went to Joanne Fabrics, and we got our patterns and we got our material, our raw material, and I think we made rockin' outfits for ourselves for Easter.
That's wonderful.
One of one. So these are reinforcement stitches. We're probably going to put some stair strips across so it doesn't gap as much and doesn't create too much tension. Pins we put up there.
Now, what is that?
This is sticky stuff.
Oh, sticky stuff.
Yep, it's going to help those stair strips stick on a little bit. So you're going to keep this dressing on for 48 hours, 2 days, and then you are going to you can remove it and do your shower, do whatever kind of normal hygienic routine you want to do. When you get done with your shower, we're going to give you a large compression sock, or I'm sorry, stockinette. It's like a roll sock, and we'll give you a compression sock, a sock that's used for compression. You should be wearing something across this ankle and this incision at all times when you're not in the shower. Oh, okay. So that means at bedtime as well too. I would still recommend you wear a bandage over it, and then that compression sock. We'll give you some bandages in case it drains. But you should wear the compression sock. These stay strips, these stickers, leave them alone. Don't remove them.
Right.
They'll fall off on their own. In 2 weeks when I see you, we should be able to take the sutures and the stay strips out. Sometimes people take a little bit longer. It may take another 2 weeks, but we'll see what it looks like in 2 weeks' time. Otherwise, showers are fine. Don't soak it. Don't, if it gets wet today or tomorrow, that's okay. Just change the dressings with what we're going to give to you. Any questions at all? That's it. I am going to write you for some antibiotics as well too. Okay. 3 days worth of antibiotics. I'll send it to your pharmacy, as well as with the anti-inflammatory meloxicam medication as well too. And have you used Voltaren before, or do you have Voltaren? Or you may find the top of the foot, the Voltaren helps a little bit more versus anywhere else. Oh, okay. So if you have the top of the foot or kind of bottom of the foot, just achiness or pain, use that.
I have that a lot.
Okay, yeah, then I would use Voltaren gel for that. If you don't want to use the compression sleeve that we're going to give to you, then use this ace bandage wrap. This is Dr. Isiorho signing off. Take care. Until next time.